Good morning. Welcome to the Dublin City School District and specifically Hopewell Elementary School. It is my honor to welcome Governor DeWine, Director Cornian, as we talk about the importance of mental health issues for our young people that we deal with every day. I've had the opportunity for the past 6 years or so to work with Governor DeWine in a number of areas, and his leadership in the area of mental health services has been unparalleled. In a time when our students have increasing challenges and needs, his leadership has led school districts to invest in providing those essential services to the students in our communities. Just here in Dublin, last week, we helped 25 mid-career educators graduate and become social workers, a program that we did in collaboration with the Ohio State University College of Social Work. And we're proud of the services that we provide here. When we look at the mobile response and stabilization service that we'll be talking about today, in this very building, our team has used that to serve our students and our families. So Governor, thank you. We appreciate you joining us today, and we value your leadership in this area. Before Governor DeWine comes up, I'd like to recognize our board president, Mrs. Diana Rigby, and the mayor of Dublin, Ms. Chris Ambrose Grooms, for being with us today. Governor DeWine.
Superintendent, thank you very much. Good to be with you again. Always appreciate your not only your input about public policy, but also appreciate all that you do and all that your team does. A remarkable team. We're here today, as you've heard, to talk about mental health and how we continue to build our system of care in Ohio to make it available to all Ohioans. A little more than a year ago, during my 2024 State of the State address, I talked about a life-changing service, a new service called Mobile Response and Stabilization Services. And I'm going to abbreviate it from here on in. So it's MRSS. Again, Mobile Response and Stabilization Services. MRSS is one of the most important tools that we have at our disposal to respond quickly and effectively when a child or a young adult is experiencing a mental health or behavioral health crisis. When a crisis like this occurs, a young person's family, teachers, anyone can reach out for help, and MRSS will spring into action right away. Trained professionals are deployed right to the child's current location within 60 minutes or less, whether that's at the child's home, at school, or somewhere else in the community. And the purpose is to de-escalate and to respond to that crisis. MRSS provides exactly the kind of help and support a child in crisis needs. It also reduces strain on other emergency services that may not be appropriate in this kind of situation. It is truly a win-win for everyone. When I took office, families in just 13 Ohio counties, 13 out of 88, had access to MRSS. Over the last few years, we've increased that number. But for a long time, frankly, we've wanted to take this statewide. And that's what we're announcing today. So I'm excited to announce that that is exactly what we are doing. The Ohio Department of Mental Health and Addiction Services and the Ohio Department of Medicaid have teamed up, and they teamed up with a network of regional partners that will finally allow us to offer MRSS in all 88 counties of the state of Ohio. Soon, every family in Ohio will be able to rest assured that if their child were to experience a crisis, MRSS stands ready to help them navigate that challenge. And the best part, in Ohio, this service is provided at no cost to the families. To our knowledge, Ohio will be the only state in the union to offer a service like this using a fee structure that ensures those who use it never receive a bill. This fact, frankly, is very, very important. We want to reduce any hesitancy that someone might have to use this service. and providing it free makes sure that there should be no barrier, there should be no hesitancy. Places across the state that have already offered MRSS have seen better behavioral health outcomes, less juvenile justice involvement, fewer inpatient residential stays for children, and fewer children spending the night in emergency departments because of behavioral health crisis. The results are very, very clear, and they're amazing, and they're very, very positive. We also know that schools are places where MRSS can be extremely helpful. In fact, it's my understanding someone right here at Hopewell Elementary successfully used MRSS when one of her students was experiencing a crisis, leading to a very positive result. And you'll hear more about that story in just a few minutes. But now that this service will be available statewide, we want everyone to not only know about it, but also to know how to access it. That's where 988 comes in. Ohioans can call the 988 Suicide and Crisis Hotline at any time when a child is experiencing a crisis. From there, the trained professionals at 988 will be able to determine the best course of action. And if that best course of action is MRSS, they will be able to deploy it. And again, that will be now anywhere in Ohio. If necessary, they will dispatch a mobile response team directly to the caller's location or to another agreed-upon safe place within the community. The young person does not have to go anywhere or make an appointment to be seen by anyone. MRSS simply comes to them. Any family in Ohio is eligible to receive MRSS services. That includes kinship families, foster families, guardianship families, anyone. Likewise, you do not have to be enrolled in any other state program to receive these services. MRSS not only provides immediate de-escalation, but if needed, families can also receive up to 6 weeks of follow-up support, and they can receive that right in their own home. The expansion of MRSS is another way our state is investing in the mental health and well-being of our children, making sure we're giving every young Ohioan the opportunity to reach their full God-given potential. Our goal is to remove any barriers that would cause them not to be able to live up to their full potential. We're committed to building the system of care that, frankly, was promised to everyone in this country when John Kennedy signed the Community Mental Health Act of 1963. However, we know that that has not really been fully implemented anywhere in the country. We work on that implementation every single day. MRSS is our next step in building that system here in the state of Ohio. I want to particularly thank Director Cornyn, Director Corcoran, for taking their two departments and working very, very closely together to make sure that this can happen. Now let me turn it over to Director Cornyn to talk a little bit more about how this expansion will work. Director?
Good morning, and thank you to Governor DeWine. We are truly incredibly fortunate here in the state of Ohio to have a governor who understands the importance of behavioral health. Unless you've personally experienced a child in crisis, it is really hard to understand just how difficult it is to know what to do. MRSS is an invaluable service that comes alongside young people and their families when they don't have anywhere else to turn. Young people like John. John's mother contacted MRSS when John was having a particularly violent episode, damaging property in their home and hitting his family members. When MRSS arrived, they were able to help calm down both John and his mother. They discovered that John's family was being evicted and they had no place to live and no food in their home. And John and his siblings were also not attending school. The MRSS team immediately set John's family up with short-term housing and connected them with local agencies for rental assistance and nutritious foods. John and his family now have a place to live. He and his siblings are attending a special school for youth with autism, and everyone in the family is receiving counseling, peer support services, and accessing case management through Ohio Rise. Our goal is to expand this service so every single child, just like John from Cincinnati to Youngstown, can get immediate professional care right when they need it. MRSS is an essential service within Ohio's system of care to fill a gap for youth and families needing urgent behavioral health services to a situation that the family or the young person define as a crisis. John's situation could have ended up much differently. He could have ended up in an emergency department, juvenile detention, or worse, candidly. MRSS is designed to avert unnecessary emergency department visits, inpatient admissions, out-of-home placements, placement disruptions, and juvenile justice system involvement. In fact, MRSS develops collaborative partnerships to assure that the services, supports, planning, and linkages are all coordinated and connected for that child. This means MRSS providers are encouraged to develop and maintain partnerships with law enforcement agencies, school districts and school personnel, child protective service agencies, and any other resource providers in the area. It's important to note that today's announcement signifies a big step forward, but we're not at our end goal yet. Our providers understand that Ohio's MRSS program is intended to ultimately offer services statewide, 24 hours a day, 7 days a week within 3 years of certification. Providers are committed to engaging in capacity building that will provide that 24/7 regional operation. They're also committed to our goal of responding to the location where that young person is within 60 minutes of calling. Additionally, providers are committed to engaging in regional quality monitoring, quality oversight, and ongoing performance improvement of MRSS services. We have truly set the bar very high, but that is because our children deserve it. I want to thank my colleagues at the Department of Mental Health and Addiction Services, particularly Tia Cokes and Tia Marcel Moretti, for making this a reality. And it's now my pleasure to introduce my colleague, Bridget Harrison, Assistant Director at the Ohio Department of Medicaid.
Good morning, everyone. My name is Bridget Harrison, and I'm a Deputy Director at the Department of Medicaid. And it's my honor to be here on behalf of Director Corcoran and the Department of Medicaid team. I would want to thank Governor DeWine and Director Cornian for their commitment to making a better path for Ohio youth, especially those who have such complex behavioral health needs. I'm sure that Director Cornian's story of John is bringing to mind a child in your own life who you have seen struggle through a behavioral health crisis. Whether it is a neighbor or your own child, I think that all of you in this room can understand how important this service is to not just those who rely on Medicaid services, but to our entire state. Caring for this exact group of young people is a passion for so many of us at the Department of Medicaid. And with the governor's leadership, we have put these kids and their families first, giving them hope in situations that can often feel hopeless. The idea of statewide expansion of MRSS was hatched years ago, and through collaboration with the Department of Mental Health and Addiction Services, idea sharing, and action across statewide agencies and local partners, we are able to bring this vital service statewide. That is a real accomplishment and proof of the difference that we can make when we work together. MRSS would not be possible without Ohio Rise. As you said, Governor, the program was built to address long-standing gaps in care and coordination that often result in families having to navigate complex and often siloed systems on their own. We now serve more than 9 times the number of kids that we did when we launched Ohio Rise in 2022. We started with about 5,500 youth on day one, and I'm proud to share that we are now serving over 46,000 Ohio kids. Ohio's legislature and Governor DeWine have been committed to improving access to behavioral health services across the state. They recognize that addiction and mental health epidemics can destroy lives and families across the state. But through programs like Ohio Rise, we can reduce emergency department utilization, and we're happy to report that Ohio Rise has reduced emergency department visits by 41% for our Ohio Rise members. And we've also reduced total psychiatric hospital stays by 28%. That means kids are away from their families for less time, and they're back in the community, back at school, and getting ready for a life of success. With Ohio Rise, more kids are able to receive care in their homes and in their communities. Those kinds of numbers really speak for themselves. And I know that by offering crisis services without worry of a hefty medical bill will only help us better serve the people of Ohio. Ohio's families really value Ohio Rise. Today's announcement of providers tasked with providing MRSS services is a huge step forward. We thank you all for taking on this tall task, and we look forward to leading a better future for so many of Ohio's children. Again, thank you, Governor DeWine, for your support, and thank you, Director Cornian, for your partnership and collaboration with your staff to make this vital service accessible to all Ohio's youth. I'll now turn it over to Principal Wittig to talk about her experience with MRSS in our schools.
Good morning. On behalf of the entire Hopewell Elementary community, thank you so much for joining us today. We are honored to welcome you and share how the behavioral health partnerships have positively impacted our students' well-being and success. As educators, we strive to meet students where they are, both academically and socially, emotionally, and provide the supports necessary for all children to thrive. We recognize, however, that some students are unable to access the academics if they do not feel safe, supported, and regulated. Our recent connection with Nationwide Children's Hospital and the Mobile Response Stabilization Service has been transformative for our school community. Earlier this year, one of our students experienced a significant behavioral health crisis here at school. In collaboration with the student's family, our mental health specialist reached out to the MRSS team for additional supports. Clinicians from Nationwide Children's Hospital arrived within the hour and partnered seamlessly with our student, their family, and our school team to develop a very clear plan for services, counseling, and most importantly, ongoing care. Today, I'm happy to share that our student is thriving. They are learning, growing, and fully engaged in the classroom each day. Their family has also reported they've seen tremendous growth, not only at home, but in the community as well. This student is a powerful example of how timely and effective mental health supports can positively change a child's life. Governor DeWine, thank you for your unwavering commitment to Ohio's children. Your leadership and expansion of programs like MRSS ensure that students all across the state have immediate access to high-quality mental health supports. Thank you for visiting us today, for believing in our children, and for supporting our efforts to build a very bright future for every child. Thank you.
Well, also joining us today are two really remarkable young ladies from Dublin Jerome High School. Kaya and Reagan are part of the district's Hope Squad, a group focusing on the mental health needs of their fellow students. And we're going to hear something from them in just a moment. But first, I'd like to ask them for their help. They're already in position, I can see. We have a map of how we will be dividing Ohio into 18 MRSS regions to ensure that every family who needs this service can get help in 60 minutes or less. And I would like to ask them to please unveil that. Or turn it over, I guess. All right. Thank you very much. Our partner here in Franklin County will continue to be Nationwide Children's Hospital. We've worked with Nationwide on MRSS for some time, and of course we've worked with them on many things as well. Before Kaya and Reagan speak, we'd like to share a short video featuring some of the amazing professionals at Nationwide Children's who help us deliver this incredible service every day. I'll get out of the way.
MRSS provides support to youth who are under the age of 21 in crisis or has a loved one who's in crisis can call. We can respond. We try to respond urgently within 60 minutes anywhere in the community. We've been to parking lots, libraries, schools, houses, of course, anywhere really where crisis can happen.
When our team arrives to a call, we are working really quickly to develop rapport with the child or young adult or family. We're quickly assessing the situation for any imminent risk or safety concerns. And then from there, we're really working alongside the family to get a clinical picture of what's going on and how we can be the most helpful.
Trying to continue to get our name out there, and we continuously have families that tell us, like, if I would have known you existed a year ago, I wouldn't have had to bring my child to the emergency room, or we could have had quicker access to care. We wouldn't have had to wait on a wait list trying to get support, or maybe we wouldn't have had to call police, or the situation could have looked just a little bit different.
So I think expanding MRSS across the state will really improve access to care for those people who may not have what they need currently in their community.
We know that everyone has mental health. When we are talking about our youth who are in crisis, that shows up in very different ways. 1 in 5 children are experiencing mental health symptoms, mental health concerns. And so access to care is crucial to be able to help support families in our communities.
It's really important right now that MRSS is available to more people because mental health is such a crisis throughout the state. We really are working hard to break stigmas and to increase access to care and to help keep kids and families out of the hospital if they don't really 100% need to be there.
Good morning, everyone. Thank you so much for that wonderful introduction. I'm Reagan Hainoski.
And I'm Kaya Pandya. We're seniors at Dublin Jerome High School and co-leaders of Jerome's Teen Institute, or TI.
Through TI, we focus on youth-led prevention, creating a supportive community where students can talk openly about mental health, substance use, and making healthy choices for their future.
We've seen firsthand how powerful peer support can be. After coming to TI meetings, students are more empowered to make positive choices and feel more confident reaching out for help when they need it.
Along with TI, Dublin City Schools is proud to have Hope Squad programs in all 3 high schools and across our middle schools. Hope Squad trains students to recognize warning signs and connects their peers with trusted adults, making early intervention possible before situations get too serious.
The success we've seen through these programs shows just how much early support matters and why it's so important to have a strong continuum of care for youth mental health.
But even with all the resources we have, we know there are still gaps, especially when it comes to getting help outside of school hours.
We're so excited to help the Governor's Office and the Ohio Department of Mental Health and Addiction Services share the statewide rollout of MRSS. It's encouraging to see that youth mental health is a real priority for the state of Ohio.
MRSS helps solve barriers like transportation and cost, meeting students where they are, whether that's at home or somewhere else they feel safe. It's an option that feels a lot less overwhelming than going straight to the emergency room or inpatient care.
And just as important, MRSS makes it easier to step in early, before a situation becomes critical. It gives students and families another place to turn to when they first notice struggles, not just when it's an emergency.
Having an option like MRSS, one that feels approachable and meets students where they are, would make such a difference. It helps normalize getting help and removes the fear that too often keeps students from reaching help.
As students leading prevention efforts in our schools, we know that the right support at the right time can change everything. And we're excited to see more students across Ohio get the help that they need to thrive. Thank you.
Okay, and Reagan, thank you very, very much. Great words. Thank you also for your leadership at school, your leadership in the mental health area, and you're both seniors. We wish you well next year. So, thank you very much. Give them a hand again. Happy to take any questions from the media.
Is there somebody who could explain where the line is between when you use MRSS and when law enforcement is more appropriate?
Sure. Leanne can. And let me just say that as I travel around the state and talk to law enforcement officers, departments are struggling with this. I was with a department just last Friday, and they had a social worker literally embedded in the department. So everybody's trying to figure out how to do this, and no one wants this, frankly, more than law enforcement officers. Leanne?
I think what's special and unique about MRSS is really the crisis is defined by the family, by the child. And that can be, maybe threats of self-harm, maybe it could be an increase in severity of anxiety or depression. It could be a whole host of different things. If that family deems it a crisis, then they can reach out. And our really wonderfully trained professionals at 988, they really know the difference of when that person, when that family can't be de-escalated and we need a mobile response, or we may need law enforcement intervention. But that line is really a threat of harm to themselves or to others.
But if somebody should call 911, would that be referred to 988 in a situation? Is there a judgment call there?
If people are really not sure of where to go and what to do, they can always reach out to 988, and 988 is able to refer emergency situations to 911. And it's a great opportunity to connect with professionals in your community near where you live who also have the opportunity, as we said, to deploy those mobile response services, but then also to follow up with those families and make sure that they're connected to supports in the community.
Who else?
So, I don't know if you guys ever heard him, but how does it work when they show up to a home within 60 minutes? How do they actually de-escalate the situation? What are some of the different things they use to try to help?
Sounds like Leanne needs to stay up here. I'll go through that.
So as you saw from the video, we have a variety of different certified and trained professionals who are on the team deploying to that location. Sometimes they're peer supporters, sometimes they're licensed social workers. So occasionally it's just separating the family members and having a peer supporter work with that child or work with that parent to kind of calm them down, to assess the situation, to understand what's going on in the home, what some of those triggers may be, and then working directly with the family to kind of model those de-escalation techniques and make sure that we're engaging that young person and that family in a holistic safety plan so that they know exactly where to go, who to go to, when to go, and that they have all of those services and supports in a really coordinated and seamless way.
Are these teams in place already and ready to deploy, or is this something that there's still training going on?
Go ahead, Leanne. You can give them a timeline to it.
Yes, so there are mobile response and stabilization services teams in over 50 counties currently. We are working over the next few weeks and months to have these teams in place, hired, trained, certified, so that they can go out and deliver these services in all 88 counties by this summer.
Who else?
So if someone were to call the 988 number expecting to see one of the response teams come out, but they are not in a county where this is available, would that be a situation then where the person who answers that 988 call would then refer it to the first response agency, whether that be police or another response? Is that how that would work?
Our 988 call takers are very knowledgeable and aware of all of the services that are available in the communities that they cover. So they'll know whether there are mobile response services available in that community ready to deploy right at the moment. Maybe it's connecting them to another community-based behavioral health agency so that they can get in relatively quickly to go see a clinician. So they're going to know exactly what exists in the community and how to connect families into those services and supports.
With this being an expansion, obviously, you said 15 or so, what counties don't currently have this, or like what regions of the state might be lacking? And unrelated, but could you kind of expand a little bit on what was, there was mention of a fine structure, or fee structure, what that would look like?
I'm sure we have a map that we can share with you that shows where MRSS exists currently. I don't have the 30 counties off the top of my head that don't have it. And yes, we have partnered very closely with the Department of Medicaid. Through their Medicaid actuary, we have identified the number of professionals we need to have statewide in order to deploy those people within 1 hour of anywhere in the community. And we've also developed a fee structure that we will be partnering with Aetna Ohio Rise on ensuring that there is a single payment to all of our providers so that they don't have to go to us for some kids and Medicaid for others. Yeah.
So Ohio Rise is the funding source?
Yes, the Department of Medicaid will be paying for services for all Medicaid enrollees. The Department of Mental Health and Addiction Services will be covering costs associated with individuals who aren't enrolled in Medicaid, but all of those resources are being coordinated by Aetna Ohio Rise, which is our managed care plan selected for Ohio Rise, to make it seamless and very easy for our providers.
And is this fully funded in the next budget?
The governor's as introduced budget includes funds to fully fund MRSS statewide.
And is that still in the Ohio House budget?
Yes. Yes, it is.
So this has to be a child in crisis, though. It cannot be someone 18 or older, correct?
It's youth 20 and under. Yes. In the governor's executive budget proposal, there also were resources included to scale this for adults 21 and older statewide as well.
And let me just say that, this is kind of the big picture. This is one major step forward to our desire, our goal, our intent to make these services available to everybody in the state of Ohio. We'll continue to move forward, but this is the end of this phase is in sight. Leanne, timeline again for the remaining counties, roughly?
Yes, by end of June 2025, so by later this summer, we should have these services in place in counties where they don't currently exist.
So July 1. July 1, this should be all in place. And again, part of responding and being able to activate emergency services is people don't have time to think. They have to know what to do. And we're going to continue to advertise. We're going to continue to talk about 988. And so this number is a vitally important number. And, we hope in the next several years that this number will be on everyone's mind. This is a response to what teachers have told us, what school administrators have told us, parents have told us. We see mental health challenges among our children, significant challenges among some of our children, and they are all our children, and we need to treat them that way. And we want to make sure that they have those services. I can only imagine a parent who is seeing their child in crisis. That parent needs to know what to do. They need to know where to go. They need to know where to call. And they need to have an assurance that within a reasonable period of time, 1 hour, there's going to be someone who will respond and will respond physically. So this is a big deal. This is something that we've wanted for some time. We've been moving towards it. Now we have a date where every county, every Ohioan, no matter where a parent lives, where a child lives in the state of Ohio, this will in fact be available. That's what we want, and that's what we're going to achieve by July 1. Anybody else?
So when somebody would call 988, whether that be a parent, a teacher, do they say, I want MRSS, or is that up to the 988 operator to decide what's going to be appropriate in each situation?
I think families can request MRSS as a service. Again, this is a crisis as defined by the child and their family. If they don't know that MRSS is available, though, then that 988 call taker can make sure that if this is a crisis situation, MRSS is deployed.
How are you guys reaching out to the ethical culture organization to address MRSS?
So we have done a significant number of listening sessions, of conversations with our provider communities, with families, to really try to understand how to design this service, how to build this service in a way that meets the needs of all Ohioans. So we'll continue to do statewide outreach and education and awareness and advertising to make sure that all families know that this exists. Certainly, we have resources for 988, which is going to be the primary way that we're deploying these services in a variety of different languages available on Ohio Moss's website. So ongoing efforts to continue to engage all Ohioans. 988 call takers do speak foreign languages. I do not know exactly which ones, but we can get that information to you.
How about the MRSS team? Are they trained in other languages?
I do not know the answer to that, but we can get that to you. Bridget?
Good morning. I would just add that one of the values of the regional model that we're using is that we are starting with local providers. And these local providers know their communities. They know the different needs of their communities, whether they're in Appalachia, whether they're dealing with a population of new Americans or of new Ohioans. And so part of our hope in really relying on those regional providers is that they are able to come to the table and know how to serve their community really well.